Hello everyone, welcome to Alacrity Explains Anatomy. Today we are going to be looking at the anatomical snuff box. So by the end of this video, you should be able to identify the boundaries and contents of the anatomical snuff box. You should be able to comment on the clinical significance, particularly regarding the scaphoid fracture and avascular necrosis of the scaphoid when there is a fracture. Now, the scaphoid is a triangular depression. As you can see from this image, there is a depression. So, the scaphoid is a triangular depression found on the dorsal aspect of the wrist. Now, it is best visualized when you want to visualize the scaphoid. It is best visualized by extending and abducting the thumb as if you are sniffing a powder. You have seen movies where people are sniffing cocaine or whatever. So when you're taking snuff, that way you as if you are sniffing a powder. That's the anatomical snuff box. That's the best way to visualize it. The thumb is extended and abducted. Now, what are the borders of the anatomical snuff box? We have the lateral or anterior border, which is formed by the tendons of abductor pollicis longus and extensor pollicis brevis. Abductor, not adductor, abduction. You look at this image, you already said that to visualize the anatomical snuff box, the thumb has to be abducted. So the muscle, the tendon of the muscle abductor pollicis longus and extensor pollicis brevis form the lateral or anterior border. The medial border is formed by the tendon of extensor pollicis longus. Please don't mix this up. Lateral border, also called the anterior border, the boundary is formed by the tendon of abductor pollicis longus and extensor pollicis brevis. There's only one abductor in the formation of the boundaries of the anatomical snuff box, and there is two extensors. The one for lateral is extensor pollicis brevis, the one for medial is extensor pollicis longus. Now on the floor, look at the image. This is the image you're talking about. This is our lateral, this is our medial side. You see the lateral is formed by two muscles, extensor pollicis brevis tendon and abductor pollicis longus tendon. While if you look at the medial or posterior, we have the extensor pollicis longus tendon. Now, if you look at the floor, what is painted yellow, you see that we have the scaphoid as well as the base of the first metatarsal. This is the first metatarsal. The base of the first metatarsal is part of the floor as well as the scaphoid. So for the floor, we have the proximal floor and the distal floor. The proximal floor is formed by the scaphoid bone, which is the most important, while the distal floor is formed by the trapezium bone, which is also important. Then the base of the first metacarpal is located also in this floor. Now moving forward, let's look at the content. If you look at this image, you also see the content of the anatomical snuff box. Now for the content of anatomical snuff box, we have the radial artery, which you can see there. You can see it here in red, the radial artery. It's a content of anatomical snuff box. It divides into the snuff box to reach the dorsum of the hand, forming the deep palmar arc. The radial artery divides into the anatomical snuff box to reach the dorsum of the hand, forming the deep palmar arc. We have the cephalic vein, which is also part of the content. Some sources say the cephalic vein is part of the roof and not the content. So, but in this video, the cephalic vein is part of the content of anatomical snuff box, and it originates here in the anatomical snuff box. So most anatomists say that the snuff box is the origin of the cephalic vein. When you want to discuss the cephalic vein, you are asked to discuss the cephalic vein. It originates from the anatomical snuff box, from the dorsal venous arc. So we have the superficial branch of radial nerve. Superficial branch of radial nerve is a gives sensory supply to the dorsal thumb and index finger, which is important for nerve injury assessment. So the sensory branch of the radial nerve is also a content of the anatomical snuff box. Now let's look at clinical correlates. We talked about the anatomy generally. Let's look at applied anatomy. We first look at scaphoid fracture, which is the most important. Now, what's the mechanism of this injury? The mechanism of scaphoid fracture is when there is a fall on the outstretched hand. A fall on an outstretched hand, which means someone falls and the hand is spread, maybe they fall with the palms touching the ground. So there's going to be tenderness directly in the snuff box. This tenderness is directly in the snuff box because the scaphoid bone has been fractured. So you feel tenderness directly in the snuff box because the scaphoid is part of the structures that form the floor of the anatomical snuff box. If you do an X-ray, oftenly it appears negative, but you need scaphoid view to view the scaphoid, but sometimes it appears negative as if there's no problem. Now, why is this scaphoid fracture dangerous? It's a very dangerous injury. The reason is because the scaphoid bone receives a retrograde blood supply from distal to proximal. Now look at this image. This is the blood supply to the scaphoid. This is the distal part of the scaphoid. This is the proximal part of the scaphoid. And blood supply to the scaphoid moves in this direction. So because the blood supply to the scaphoid moves in a retrograde direction, it moves from distal to proximal. Whenever there is a fracture, let's take it down. There's a fracture at the waist or the middle of the scaphoid bone. And remember, this is the most common site of scaphoid fracture. The waist of scaphoid is the most common site of scaphoid fracture. Reason being that the waist is thin, the thinnest part of the scaphoid. So whenever there is a fall on an outstretched hand, the waist of the scaphoid is the most likely site to be fractured. Whenever there is a fracture of the waist of the scaphoid, it will interrupt this blood supply. It will interrupt this blood supply at this point. When it interrupts this blood supply, the proximal pole or the proximal part of the scaphoid loses blood supply. We now have a vascular necrosis, which occurs in about 30% of cases. Now, this blood supply to the scaphoid that enters distally is not common in everybody. There are some people that the blood supply enters proximally. Some people, the blood supply starts at the waist and divides into two. But in a good number of people, the blood supply, in the 1/3 of the population, majorly 1/3, the blood supply of the scaphoid enters in a retrograde fashion from distal to proximal. So it's a fracture at the waist, proximal part suffers a vascular necrosis. Now let's say there's a fracture at the proximal part. If you look at this image, the classification of scaphoid fracture. We have distal fracture, if it occurs here. We have waist fracture, that I just showed you. We have proximal fracture, if it occurs here. Now, in a case of a proximal pole fracture, which is this, number 3. In the case of a proximal pole fracture, about 100% of vascular necrosis occurs, because I am saying that in 1/3 of the population, blood supply to the scaphoid enters from distal to proximal. That means in 2/3 of the population, which is the major population, blood supply to the scaphoid enters from proximal to distal. So when this happens, if blood supply is from proximal to distal and there's a fracture of the proximal pole, 100% of the remaining part of the scaphoid is going to have a vascular necrosis in 100% of cases. So that's what that means. So moving forward, we also have the de Quervain's tenosynovitis. De Quervain's tenosynovitis. I don't know how you pronounce that, but this is an inflammation of the lateral tendon. We talked about the abductor pollicis longus and extensor pollicis brevis, which we said they form the lateral border or the anterior border of the anatomical snuff box. Now, the tendon sheath that surrounds these tendons, if there's an inflammation of this tendon sheath, you have pain in this area. See this area of redness? It's going to be pain in this area, and that is what we refer to as de Quervain synovitis. We now also have the radial artery palpation. Remember, the radial artery is a content of the anatomical snuff box. It's located in the floor of the snuff box and is often palpable at this site. If you press, if you extend, we said to visualize the scaffold, the anatomical snuff box, you have to extend and abduct. So when you do that and you apply pressure into the anatomical snuff box, you're going to feel the you'll be able to palpate the radial artery. So it's often palpable here, especially if the distal radial pulse is weak. So it serves as collateral circulation through the ulnar artery. Thank you for watching. Don't forget to like, share, and subscribe to Alacrity Explains Anatomy for more videos.